This Week in Virology, the podcast about viruses, the kind that make you sick. Hello, ESCV! Yeah, a little muted, but that's okay. From ESCV 2025, this is TWiV, This Week in Virology, episode 1255. That's 1,255 episodes recorded on September 17th, 2025. I'm Vincent Racaniello, and you're listening to the podcast all about viruses. Today, we are coming to you from Thessaloniki, Greece, which is the site of the 2025 meeting of the European Society for Clinical Virology. And joining me today from the University of Manchester, ESCV President Pamela Vallely.
Hello.
Also joining me from the European CDC, Piotr Kramarz. Welcome. All right, we have a quick TWiV today, so we have to get right down to the questions. Pamela, what is ESCV and what does it do?
Well, firstly, it's fantastic, obviously. It's the European Society for Clinical Virology, as everybody here knows. It's been around a long time, actually. It was first formed in 1987, and it's a charity, a not-for-profit charity. But actually, its forerunner went back much earlier than that, right into the early 1970s, when it was known as the European Group for Rapid Viral Diagnosis. And essentially, that ethos is what's come forward into ESCV. So the aims of ESCV are to ensure that virologists are able to interact with each other for both educational and research purposes. And I think, the meeting allows us to do that. To improve clinical virology and to improve the knowledge of virology among healthcare professionals and among the public, and particularly diagnostic virology. And I think, our meetings, our workshops, all of the things that we do across the course of a year, I think help to promote that. I hope so anyway. I hope you all feel that they do.
So there's a particular emphasis on clinical virology, right?
Clinical virology, yeah. And I understand from historical documents that was supposed to be an element of bringing clinicians and laboratory virologists together, and that term clinical virology was coined to bring those two together.
I did hear some research talks today, though, so you're flexible about that.
Yeah.
So Piotr, European CDC, has been represented before on TWiV. We had Eva Broberg, right, on TWiV 1069 in Milan. You remember that? You do remember that. So what is ECDC and what does it do?
Well, first, thank you very much for the invitation, Pamela and Vincent. It's such an honor to be here for a non-virologist. I'm a medical doctor, but I worked as a clinician, so I'm happy about this link that you just mentioned. And TWiV, to me, I watched TWiV and I'm a fan, and I figured that to rise to a level of celebrity in virology, you need to be
now you're
TWiV,
famous,
so,
yeah.
So for me, it's like the apex of my career, definitely. So thank you. Thank you very much. But I have to say something about ECDC. ECDC, it's a European scientific agency, a European Union agency, that basically is charged with prevention and control of communicable diseases. Our mandate focuses on communicable diseases. I memorized it. Our mission is to identify, assess, and communicate threats to human health from communicable diseases. And this is just one sentence, but of course, behind this, there are many tasks. It all starts with surveillance. We collect data from all the member states of the EU and the European Economic Area countries on about 60 diseases. And before this meeting, because this is about virology, I try to count, and the viral pathogens there are about 21. So it's 1/3 of all the diseases. And there, the member states report the data to us. We keep them in a database. They are in standard format, and we analyze them and produce reports. And based on this and other sources of data information, we issue scientific advice. And this could be on measures to prevent and control outbreaks, on vaccination. During COVID, we issued a lot of guidance on the use of personal protective equipment and other stuff. But we not only sit in Stockholm and produce reports and analyze the data, we often deploy to outbreaks not only in the EU, sometimes in collaboration with the WHO, we investigate outbreaks outside of the EU. And if I may use this as an opportunity to advertise some things, if it's allowed, we have a training program which is called Fellowship, ECDC Fellowship. It's a hands-on, very good 2-year program. We train people in field epidemiology or public health microbiology. We have 2 tracks. And if you are qualified, you end up in one of the public health institutes in a member state, not your own, you are always in another member state, and you learn by doing things, and then there are modular trainings. And we actually opened the new call for applications. So if you think you meet the criteria or you know someone, please talk to me during the break. I can tell you how to apply. If people qualify, then the program starts next year, actually, in September. But by looking at you, I see, because there's this minimum requirement of having 2-3 years after the diploma, university diploma, I think most of you meet this criteria. So talk to me, please.
So ECDC is in Stockholm, correct?
Yes, we are based in Stockholm, so there is quite a challenge to move here because of the climate. But my Swedish colleagues told me not to joke about Swedish weather anymore because I do too much of it.
When was ECDC started? What year?
It's 2005, so actually in November we'll have our 20th anniversary.
Would you say that the US CDC was a model?
It's difficult to say that really. I worked there, I did the US equivalent of this training called EIS, Epidemic Intelligence Service, class of 97. But because of the size and the history and the duration of operation, it's hardly comparable because, of course, CDC Atlanta is much bigger and existed for a longer period of time. And, of course, for years now, they cover non-communicable diseases and they have labs. We don't. We coordinate networks of laboratories. So there are many differences. But I guess that the core tasks, especially at the beginning of CDC, were similar to that of ECDC.
Okay. Well, I use your website often. We have some problems with CDC in the US lately, and I like to get data from your site. So you don't have to say anything. I know that you can't get involved in politics. That's Pamela.
Well, thank you. That's a compliment to ECDC.
Does ESCV participate in teaching members about new technologies like NGS?
Oh, absolutely. Yeah, I mean, so as well as this annual meeting that we run, we, over the year, do workshops on much more specific topics, and often they will include the sort of latest technologies and an opportunity to see, who's using them and how. And in particular, lately, we've run some really successful NGS workshops, which we've had massive interest in, and every time we run one, it's massively oversubscribed. Because I think that reflects the fact that, clinical virologists want to know more about this technology and know how to adapt it and use it for themselves. So I hope, that the ESCV is able to help in that way. Perhaps I can just add to what Piotr was saying, because ESCV and ECDC have a close relationship. And, in the past, we have funded people to go and observe the ECDC works to sort of see if it is something that they might want to do in the future. So I think, again, that's a useful collaboration between us, really.
Yeah, it's interesting. In the U.S., someone mentioned today that the U.S. doesn't have an equivalent of ESCV. There's no clinical virology, but we do have the American Society.
The Pan-American Society, yeah.
And the Pan-American, but ASV does not interface with CDC as far as I can tell. So that's a unique aspect. I think that's very good. So Piotr, does ECDC deal only with current epidemics?
No, of course, this is a big part of our work, is what the current threats or emerging threats, but of course we work on the more chronic ones. as well. And when we talk about virology, of course, there is still the HIV epidemic going on, and hepatitis B and C. And I don't want to go to too much detail, but there we recently published a toolkit on to help, of course, with elimination of hepatitis B and C in prisons, because in August there is the world, I think, or global Prisoners' Justice Day. So before that we published this toolkit, because there is a big problem in the prisons everywhere, but also in Europe. A lot of the inmates are infected with hepatitis B and C for various reasons, also because there is an over-representation of intravenous drug users. So we put together this toolkit, how to plan the diagnostic screening and linkage to care, and maybe vaccination programs, and in general to raise awareness. And we do more in Europe. According to our estimates, there are around 5 million people chronically infected with hepatitis B or C, so it's quite some proportion. And unlike HIV, most of them, I think, according to our estimates, they are not aware that they are infected. So there is a lot to be done in terms of screening, testing, and linkage to care. So yes, we work on these more chronic issues. Also try to find some balance between them.
In your opinion, what is the current most pressing acute epidemic?
It's difficult to say globally. I think when we have two big problems. One is the antimicrobial resistance, where there is a lot of resistance to antibiotics, of course, but antivirals as well. And the other big problem is that we have very well functioning vaccination programs with very high vaccination coverage, but there is this spread of distrust in science, undermining the vaccination programs and decreasing the coverage. And of course, a lot of the vaccine preventable diseases are viral diseases. So these are probably the two big chronic problems with which we deal, this kind of distrust in science and vaccination, and then antimicrobial resistance.
So, in the US, we have states. We have 50 states, right? Did you know that the states feel that infectious diseases are confined by the borders? Yeah, you knew this, right? So I want to ask you, is this the case in Europe as well, or do they spread?
Of course, yes, they totally stay within the administrative boundaries. No, of course. I mean, it's one of our mottos that because in the EU we enjoy the freedom of movement of people,
yes,
goods, etc. But unfortunately, the pathogens, they enjoy that freedom as well. So we have to really be on the lookout. So we have to. There is this need to coordinate, because of the situation differs between the member states in terms of how well they are equipped, how big they are, how many resources they have. But there is always a need for coordination, and also to facilitate learning from each other, sharing best practices. This is a big role. The big role that I see is that we have is what we call the convening power, that we can bring networks together and people can share.
But you can only make recommendations, right? You don't. So the CDC in the US, they make recommendations. They can't enforce. Is it the same with ECDC?
In the EU, because of how the treaty on the functioning of the European Union works, health, of course, is deregulated, and it's in the mandate of the member states. But our mandate, actually, as ECDC, got strengthened after the pandemic, and we can issue now recommendations. However, they are non-binding. Of course, the countries may not accept them, but this is quite a strong word. We can give recommendations now. Okay,
Pamela, I have a challenge for you. I want you to tell me about these affiliated networks of the ESCV, and you're going to have to spell out the acronyms, okay? NPEN, ENNGS, and ECCI.
Okay, well, so ENPEN is the European Network for Non-Polio Enteroviruses. And ENNGS is the European Network for Next Generation Sequencing. So I'll deal with those two first because they are properly affiliated networks to ESCV. And they arose really from members of ESCV being particularly interested in those areas. Heli and Tia for MPen and Jute and Xavier and a few other people for ENNDS. And essentially they put together a network of people who are interested, and they've begun to do some really important work, and I think it's a great part of ESCV. They have done projects, they have published papers, they've given talks, we've held networks, workshop meetings where people come together, and it's really growing, and I think they're really strong elements of ESCV. And if people have other ideas for strong networks that they might like to get affiliated with ESCV, we'd be very happy to do that. We offer as much support as we can in the form of helping to get workshops ready, giving travel grants to go to workshops, those type of things. ECI is the European Congenital Cytomegalovirus Initiative, and in fact it's the one I'm the most involved with, although it's not quite as affiliated to ESCV as the other two, simply because ECI was already formed before it came into partnership, if you like, with the ESCV. But again, we give it support, we help it to grow. It has now become a society in its own right. So it perhaps hopefully needs a bit less support from ESCV in the future, but certainly in terms of coming together with us and supporting each other, and that's something that we really want to do. So they're really strong, focused networks that sit within ESCV. ESCV is a much broader church, of course, but it's nice to have those areas of expertise within the society.
What does ESCV provide to these networks?
So up till now, what we've provided is we've run individual workshops based on those, and to those workshops, people can come and pay to go to them, but we've also provided a large number of travel grants, particularly for early career researchers, who are interested in that area and who want to get involved with the network. So what how ESCV works is that, our subscription fees, any funds that we have left over after we've done a meeting, we plough those back into the membership, really, in terms of travel grants and bursaries and so on, to allow particularly early career researchers to come and benefit from mixing with more experienced researchers in a smaller atmosphere of the workshops, and of course in the main meeting.
These workshops happen at this meeting, but also outside, right?
Yeah, so this is the first time that we brought the NPen and the ENNGS workshops to be the pre-meeting for the main workshop, for the main annual meeting. I think it's worked really well, and it's allowed them to have a bit of crossover. But in previous times, we've held them separately, and I think we'll probably go back to doing that in the future, at least for some of them. But it's worked well to have them as the pre-meeting for this annual meeting this year.
Piotr, can you talk about how ECDC deals with viral threats?
Yes, I think it all starts with what we call epidemic intelligence, where we have experts who, during the core hours of ECDC work, they scan various sources of data. We also have automatic programs. I think there's a program called Epidemic Intelligence from Open Sources, or EOS, that scan the net looking for anything that looks like an outbreak. Of course, we do it globally because all the diseases are basically 1 or 2 flights away from Europe. And after core hours, we also have like a duty system. So we do it basically 24/7 since day one of ECDC existence in 2005. We have first-line duty officers, second-line duty officers. Actually, I was a second-line duty officer until Monday morning. And on Friday, we always publish, you can have a look, we publish on our website what is called CDTR, which stands for Communicable Disease Threat Report. It's usually the first thing that you see when you open the website, and there you see the summary of the threats that we worked with during the week. And I looked at the Friday one, and out of 11 threats described there, I think 9 are about viral diseases. The only one non-viral was the Plasmodium falciparum. I think there was some suspicion of transmission here in Greece. but the rest are viral threats. Of course, we are at the end of summer, so still a lot of noise about vector-borne diseases, like you saw on some presentations earlier today. And now also we started speaking about the upcoming season for respiratory viruses, but most of the threats are viral. And then if anything happens, we tend to issue, if there is something major, what we call rapid risk assessment, where we try to estimate the risk and then suggest or recommend measures to take to contain the risk. And then if there is something really big, then we activate our emergency procedure. For COVID-19, we were at the highest level of our emergency for almost 3 years, with teams of experts working in our emergency operations center in tours for almost 3 years. So there are different kind of levels of how we can react to a threat.
So in the US right now, we have a COVID surge. We usually have a late August surge, and it goes down, and then the winter surge again very soon. Do you have the same pattern in Europe?
In Europe, actually, it's difficult to speak about seasonality of SARS-CoV-2. What we see actually is like summer increases for the last two seasons or years, where we see summer increases and then the activity going down, and in winter almost no activity, which is probably driven not so much by the climate but by the population immunity. So definitely too early to say something about the seasonality of COVID. I think it was shown also in some of the presentations today.
Okay. So Pamela, what actually happens at the ESCV meeting, which we're at now, actually?
So at the meeting, how we run the ESCV meetings is that somebody puts forward a bid to run a meeting in a particular place. We look at everything that is there, if they've got everything in place to be able to do that, and then we allow them to run it locally with help from the ESCV executive. So each ESCV meeting has a different flavour, but I think it always has that same kind of almost very friendly atmosphere. I hope everybody feels that. You see a lot of the same faces, but you see a lot of new faces coming in. It's great to see so many young people this year at the meeting. So what happens? There's a whole year lead up to it to get all the speakers and everything in. We have the keynote speakers. Everybody submits their abstracts, and we sort those into orals and poster presentations, as we do for most meetings. And then we sort of allocate the oral things through the program. When people arrive, we always try to make sure that we have a strong industrial presence, because a lot of people working in labs, those are the people that they want to talk to. So we try and have a good balance between the industrial symposiums and the trade stands and the science. We always incorporate some social events. They're always usually very good. Posters, lots of interaction at posters. I'm not sure what else.
So do you welcome scientists from other than Europe?
Of course, absolutely, yeah. I mean, we're a European society, but we welcome everybody. In fact, I checked just before, and we've currently got 617 members, but those members are spread across 47 different countries. So we're not just Europe-based. And I know that we have delegates from India and Brazil and lots of other countries, Middle East, Japan, Korea, South Korea. We're definitely an international society.
So given the changes in U.S. science this year, have you seen any decrease in U.S. participation in this meeting?
Yeah, so I couldn't get the figures for how many people had registered from the US, but sadly, I have to say we've only had 5 abstracts, and that's less than previous years. Certainly it's half of what we had last year, for example.
What's happening is very sad. I follow it on a daily basis. We talk about it all the time, and I hope we can get out of it.
However, I will say that our NPEN poster winner today was from the US, so clearly the science is still going on in some form. It's still there. So
yeah.
good.
Piotr, how does ECDC strengthen pandemic preparedness?
There have been a number of lessons learned from the COVID-19 pandemic, and in terms of preparedness, one thing that we've been doing as ECDC is we coordinate missions to the member states of the European Union to discuss with the experts from each country the level of preparedness, the status, and we are supposed to visit one country in the European Union once every 3 years, which means that almost once a month there is a team of experts going to one country for about 1 week. Of course, there is a lot of preparation, review of documents, then an intensive visit, and then a plan of action formulated in a report. Some of the reports you can see published on our website already, and this is very important. We get very good feedback from the countries visited that this is very needed. There are several areas that are reviewed: surveillance system, of course, laboratory system, plans for or mechanisms for coordination between the different sectors and other areas. And then the countries can request, they can add other areas to these assessments. And yeah, this time we want to do it better, because when the COVID pandemic hit Europe, then all the member states had some sort of pandemic plans, but some of them were a bit outdated or not necessarily tested in exercises. So now there is a very systematic process of visiting countries and working with the country experts on preparedness.
Pamela, does ESCV participate in science communication to the general public?
Yeah, to a certain extent, yeah. So how do we do that? I would say we have on our website some resources that are accessible. In fact, we even have some books on there to sort of teach children about viruses and vaccination and things. And we have webinars and so on. I think probably the most interaction that we're going to be having in the future with the public is going to be via our networks, actually, because, you know, as they develop proposals for things, then they will interact with, you know, certainly ECI has a strong interaction with patient groups, and, you know, NPEN probably the same. So perhaps we could do a bit more than we do, and maybe that's something we'll look at for the future. But certainly we do some of that, yeah.
Piotr, there's an increased distrust of science in the world. There's a lot of anti-vaccine sentiment. Does ECDC somehow deal with this?
Yes. Well, I think we used to primarily communicate with experts, and there are various forms of this. And if I may, I wanted to advertise one more thing. We have an upcoming conference on applied infectious disease epidemiology, ESCV in November. There's no competition, Pamela. I think it's about applied epidemiology, and this one is about virology. So I think it's perfect alignment. And people can register for virtual participation. It's free, and it's possible. Now it's possible until the very beginning of the conference, 19th of November. So I would like to encourage everyone. I can give you a link during the break. Just talk to me. But experts, yeah, we've been communicating with for a long time. But now there is this thing about the distrust in science and in the general population, and we see it especially after the COVID pandemic, and especially in the area of vaccination, with vaccination coverage going down in some areas. And there are several ways that for us to address it. One is, of course, to equip people in the member states to do something about it. And we have one training, e-learning, on our website. Again, I can give you a link to it if you ask me, on how to address misinformation and disinformation on vaccination online. It's very interactive, and it teaches people how to confront such a situation. And we more and more use social and behavioral sciences to confront this. And an example could be, we again put on our website a report on how to increase the uptake of vaccination using social and behavioral sciences. And there we suggest first to do what we call a social diagnosis of a problem, why people don't want to get vaccinated. And there are several factors. People don't necessarily we don't need to blame people that they are vaccine hesitant, because that's just part of the problem. It's often a problem that they are complacent, they don't believe that the disease really is important, or maybe there are constraints actually with getting the vaccines. So first we suggest a good diagnosis based on some survey, talking to the communities, what factors play a role, and then based on this to build like an intervention, a program to increase vaccination acceptance. And we would like to transplant it to other areas also, not just vaccination.
All right, we're out of time, but I have one more question for both of you, and this wasn't on the list that I sent you. I want to know, Pamela, what do you do when you're not doing science?
I walk my dogs. I drink good wine. I lie down in a dark room.
You don't garden?
No.
Because I thought you might be a gardener. Okay. Piotr, what do you do when you're not doing science?
I know it will sound strange here with this weather and in Thessaloniki, but I'm part of a group that does winter swimming once a week in winter in Sweden. We cut a hole in the ice and we jump there for a few minutes. So I'm not sure if it boosts your immunity against viruses. There's not much good research on that. But if you visit Stockholm, again, please contact me and I'll arrange for you a session.
Are you serious?
They know.
He's real? Yeah. Why don't you just take a cold shower?
It's too boring.
Oh my gosh. Well, I'm not going to call you when I come to Stockholm. It's okay. All right, that's a TWiV 1255 at ESCV 2025. I want to thank the ESCV organizers for having TWiV again. By the way, this is a good way to communicate from ESCV. I've been lucky to be at quite a few of these meetings, and so you should keep it up. I like to come here. Just give me a little more time next time, because we could do a lot more questioning. I want to thank my guests, Pamela Vallely from University of Manchester. Thank you so much.
Thank you.
And Piotr Kramarz from the ECDC. Thank you so much. I'm Vincent Racaniello. You can find me at microbe.tv. You've been listening to This Week in Virology. Thanks for joining us. We'll be back next week. Another TWiV is viral. Thank you.